Hello, hello. I want to welcome everyone to Experts Unplugged. These are speaker spotlights from the Medical Fitness Association conference, where I, as a fellow speaker at the conference as well, I'm going to highlight some of our amazing speakers at the conference, which is the Medical Fitness Association's 33rd annual conference, which is coming up November 1st to 4th at the Baltimore Convention Center in Maryland. I'm Joanne Newborn. I am CEO of Newborn Evolution, where we transform your organization's vision into real results through leadership coaching, training, and consulting at all levels of the business. So today, I'm very excited to be talking to Douglas Sham about his talk, The 3 R's for Successful Programming: Referrals, Results, and Retention. And Douglas is the manager of HealthFit, which is powered by Sarasota Memorial Healthcare System. He earned his Bachelor's of Science and a Master's of Education from Springfield College. He's a certified exercise physiologist, personal trainer, and group exercise instructor through the American College of Sports Medicine. And he has stepped into many roles within the fitness and wellness industry as a personal trainer, a group exercise instructor, clinical program lead, public speaker, and Medical Fitness Association conference speaker presenter. This is not his first rodeo. So we are here with a real professional. Thank you so much for sharing time with me today, Douglas.
Thank you so much, Joanne. This is an honor. And again, thank you for allowing me to take this time.
Oh, yeah. Thanks for being here. So my first question that I have for you is, do you think being a certified medical fitness facility helps your programs to be successful?
I definitely think it does. So one thing that we notice is that when we have physicians coming to us for our programs and trying to refer their patients, one of the highlights is the fact that, one, they know that our staff are certified and also degreed, so that their patients are getting the value and also the type of work that they need to have done with qualified staff. And I think the Medical Fitness Association stands for that criteria and that standard. And so by holding our staff to those high standards, it allows credibility for our facility to be able to say, hey, bring your patients to our programs because your patients will get the right type of care while they're in our programs as participants.
Amazing. Yeah, I love that sense of credibility. Absolutely. And how do you decide what programs to implement at your facility?
A lot of it goes kind of two ways. One is from our actual members who either already have some type of condition or chronic illness, and so they've been asking for this specific type of program. When we first started our osteoporosis program, we actually had a number of members with osteoporosis asking for that type of program. So all we did was just answer the call. Our Parkinson's program that we currently have, we have a large Parkinson's demographic here in Sarasota, Florida. And so when they started coming to our facility, we had our Neuro Challenge Foundation organization be part of our facility. And so once they saw what we could offer, they asked whether or not we could start some type of program for their Parkinson's demographics. And so we started outlining a Parkinson's program for that. In addition to that, we had physicians and actual hospital departments come in and ask whether or not we could partner with them. We just started last week on the 13th, a diabetes type 2 prevention program. And that was just through our diabetes education and disease prevention department to ask and say, hey, we want to start this program for 12 weeks and work with you on the wellness side of it. Because with them, they have the nurses, they have the dietitians, but they don't have the exercise component. And knowing that we're all part of the same healthcare system, it just made more sense for them to reach out to that extra part of the continuum to say, can we align with you for some type of exercise program? And so now we have this 12-week program that's going on that started last week. So we have physicians asking for it as well as departments. Then we also always have our members driving our main programs that we have here.
That's incredible. I love the way, you've got that real pull that's coming. You've got people coming to you asking for the programs.
And I think could
yeah.
I just add, I think that's one of the things about the presentation that I'll be talking upon is how are we finding these programs out and why are we choosing specific programs to use or implement? And I think one of the things is not just throwing out 1,000 different types of programs and hoping one sticks, but actually using surveys from members or just having someone go out to all the physician offices and the departments within your community healthcare systems and asking them what they want and whether or not you can provide a service for those entities as well.
Yeah, that's great. I often talk about bright, shiny object syndrome. And you were saying like throwing all these programs out there. And you don't want to do that. You want to have the ones that have the most impact. So you're doing the research to find out first rather than just throwing a bunch of spaghetti at the wall in a sense, which is great. So what key takeaways do you want attendees to gain from the presentation that you're going to be doing?
So I think the first one is kind of what I just mentioned was trying to know what type of programs you should have. And again, in order to have a successful program, you want to make sure that the first program that you have buy-in, not just from the participants, but also from your referral sources. And that could be from current participants or members of your facility. But at the same time, what other resources do you have out in your community that you could actually touch and tie into? So I've heard a lot of our moms and babies and me type of classes that are done at local YMCAs or community centers. And so when we decide to put in a Moms in Motion, we really tried to find out what other sources of referrals could we actually do to be able to bring in more of these moms. And so we reached out to our moms and baby unit at the main hospital to see whether or not they wanted something that we could provide. And once they said, oh my goodness, we were looking into something like that and we would like to partner with you, that was something that we didn't have to try very hard to get that referral source. They were ready looking for it. And so at that point, we just continued the extension of what their idea was. And so one of the big key takeaways is don't stress on trying to find 100 different programs and hoping that one works. Do the research before you do that, before you implement a program. The other one is also just trying to remember that the physicians aren't your only referral source, that patients and community members are much larger populations than your physicians are. And so if you can get the buy-in of several of your participants that are currently big advocates of your program, they will start bringing in the numbers. So a good example of that was, again, going back to our osteoporosis program, we kind of fizzled back after COVID and a lot of our members stopped coming to our facility. We reinvented the osteoporosis program and had about 7 to 10 people in that program to start off about 2 years ago, back in 2021. Last year, we had this one participant that decided to join up after feeling comfortable coming back to our facility. And she alone brought in about 7 to 10 people. And now we have 50 people in our osteoporosis program. We have 3 different cohorts at 3 different times, but it only took that one person to generate that big response. And that's a big takeaway that I want people to realize is that you have to trust your members. They're the ones that will advocate for you and not just the physicians that you're trying to go after.
Yeah, that's
The the last one is to not think small and not think that just by giving away programs that you can't make some type of revenue off of it. And so again, my whole presentation is on 3 R's, and the last one is that revenue. And
Mhm.
so just knowing that you can always get people to pay for a service as long as they value that service line. And so as when we started to look into how much we were going to charge our members for these programs, we took the fact that we are MFA certified and that we have these credentialed professionals. You don't see a doctor reducing their cost of their care just because they want more patients to come in. They know that their standards of care have a high expectation and that they're going to provide that type of service for that patient. And so the same thing goes with our staff. Our staff are certified professionals, all degreed in exercise physiology and exercise science. They have the knowledge that they can work with these patients to give them a higher level of service and care that they wouldn't get at any other fitness facility. Therefore, when we start looking into how much we're going to charge for these programs, our
Mhm.
members are willing to pay for it. And that's how we actually pay for our staffing, is that it makes the cost of our staff lower by knowing that we can charge a little bit more. And again, the evidence is, what's the saying? The um blank is in the pudding.
Oh, the proof. The
The
proof
proof,
is in the
right?
pudding. Yeah.
So the proof is in the pudding with our osteoporosis program. They're paying a good amount of cost, but we have enough people to justify that cost. And also, with that many people in the program, it's actually paying for our staffing, and we're still making a profit off of that. So just know that as time goes on and you start to think about how you're going to align your programs up, you really have that buy-in from our members. And that's where the retention comes in as well. Our members now are lifers. They don't want to leave our facility, even though we've asked them that they have to graduate from our program.
Yeah.
They don't want to. And when you have a success of something like that, where it becomes so organic and they don't want to continue to go somewhere else because they found the value within that one program, and anything else they do within your facility is just icing on the cake, you really have them as a retained member for life. And I think that's all the takeaways that I really want my participants to know.
That's great. And as you were talking, I'm thinking, well, there's one more R here, relationships. I feel like you're really building relationships as well.
There's so many R's that
Well, I want to thank you so much. Is there anything else you want to add before we wrap up our little golden nugget together?
I really, I wish that everyone has a really good time at this next MFA conference. I look forward to everyone joining the great talks that we have, and also stop by, sit into both of our presentations. And I'm always happy to have discussions with anyone. If you see me walking down the hallway, stop by, say hi, spark up a conversation.
That's great. Absolutely. So just as a reminder for everyone, Douglas will be speaking on Thursday, November 2nd at 9:30 a.m. So make sure that you catch him. This is fascinating. I'm all about, business development as well. So this is, something that really interests me. And I'm going to be speaking on Friday, November 3rd at 8:30 a.m. So I'm going to be talking about creating rock stars, evolving into high performance teams. So let's have some breakfast together, bring your coffee, come join me, really so that you can create a team that allows you to do what you do best and letting your team do the rest. So important for business. And I really want to thank you, Douglas, and I really look forward to meeting you in November.
Likewise. No, thank you again for giving me this opportunity to talk with you.
You're welcome. We'll see you soon. Bye-bye.
Have a good one.